Dr. Hill, could you talk a little bit about, we hear a lot about childhood obesity and a little bit about the problem and where it is at this point of what you've seen in your years of study?
Well, the problem is not new. It's a problem that's been growing, no pun intended, since the early 20th century. Prior to 1920, there was very little obesity in any part of the population, but guess what happened? We got something called an automobile, and we fell in love with an automobile. Before, people walked, rode bicycles, rode horses, which is a wonderful way to burn up calories, horse. And that, over the years, we then got inexpensive food. We have the most remarkable advertising industry in the world. And all these things together changed our culture. And our culture's been changed for 80 years. And the consequence of that has been an epidemic now of overweight and obesity. In fact, Mississippi, unfortunately, leads the nation in that epidemic, with about 66% of our population either being overweight or obese. Children, it starts with children, of course. That means the solution's got to start with children. You know, somebody said that if we have an epidemic of polio or an epidemic of the plague, all the stops will be pulled out to fight that epidemic. Well, we have an epidemic that kills almost 300,000 people a year in this country and costs us $110 billion. It's an epidemic. One of our first presidents, Thomas Jefferson, said every new generation needs a revolution. Well, I think we need a revolution in health care, and I think it has to start with children. It has to start, well, needs to start prenatally, but at least what we can do as communities to start with children. Children build good habits if they're taught good habits. Now, they may stray away from those during their early years, as many of our teenagers and young adults sow their wild oats. I'm not saying that's good or bad, it's just what happens. But if they've had that solid background of habit building early, they come back to it. But we don't build that solid background for health as we should as a country, and we know that. But this war is winnable. We just have to go back to primary prevention, which is one of the reasons that many communities are beginning to band together. And I think the secret will be community activity across this country. Small communities, large communities, but we'd like to see, and hopefully we'll see the medical profession, the doctors, nurses, pharmacists, technicians, and so forth of this country lead this revolution, because I think people respect what the medical personnel tell them, and I think our credibility is good. But we need to be leading this movement, if you want to call it. I like to call it a revolution.
Mm-hmm. You mentioned about building good habits. What kind of things like that can parents do if they're concerned about their children, or even they don't want to get to the point where they're even concerned? What can they do to help this or prevent it?
The availability of good dietary practices for families and children are available everywhere, in every magazine and on the web and everywhere. But you got to look at them, you got to read them, and you got to follow them. And I think that's one of the problems we have. What I really dream of is a time when we'll see coordinated school health education so ingrained in our school system that health will become just as important or more important than academic endeavors like math and social studies and so forth. When that happens, then I think we'll see those grades in math and reading and so forth go up because of the improved health of children. The evidence is solid. Healthy children learn better. Their brains work better. And parents have an enormous responsibility here. Now, I often hear people say, well, but the good foods cost too much. Well, that's not necessarily true. However, availability sometimes is a problem. In our rushed society, unfortunately, sometimes convenience is more important, and affordability is more important than anything else. And actually, that's not a good thing, but something we have to change. I would also like to see the food industry become a leader in innovative ways of producing nutritious, small quantity foods and meals, and actually being a leader in some of this movement toward healthier eating. Now, if anybody wants to lose weight, the last thing I want them to think of is the diet. I want them to think of exercise. And people have heard me say over and over again, exercise is a secret to health. It affects every kind of illness you can imagine. Heart disease, strokes, cancer, disability. It affects diabetes. It affects all of them. And exercise is a secret to health. So if somebody wants to lose weight, the first thing they need to do is have a solid and good and regular exercise program, something they like to do. And it should be something that's not so painful, something they really like to do. And the possibilities are just innumerable. Walking is probably the easiest of all exercises. We know people who have lost 50 pounds and haven't changed their diet at all because they've walked a lot and regularly. I just saw a lady 3 days ago at a meeting who had lost 70 pounds. Now, she walked 2 hours a day. That's an enormous amount of time. But she didn't change her diet. She walked 2 hours a day. And over a year and a half, she lost that much weight. And she changed her lifestyle. And everybody knows that diets are a temporary kickstart to weight reduction, but lifestyle change is the only permanent way to lose weight.
That's right. You mentioned communities will band together and do things. What type of things can communities do to fight this problem?
Well, a lot of things. First, they're the physical things. You know, it's interesting that you go through communities throughout this country, you don't see many sidewalks even anymore. You certainly don't see many bicycle paths or walking paths. We go to some of our countries where the obesity problems in the world, where obesity problems are not as prevalent, and you'll see bicycle paths along every major street and highway. Isn't that interesting? They can build walking tracks. They can build sidewalks again. They can encourage people to use stairs and not elevators. They can encourage parking lots to have signs that tell people how far it is if they park a certain distance from the entrance, and exercise. There are all sorts of things they can do. But the most important thing to do, I think, is get a coalition of people in the community, from every part of the community, to want to emphasize health and emphasize exercise and weight reduction and all the other things that lend to good health. They also can begin to petition and support their school boards and their school systems in big ways. The school health nurses across this state and country have known for decades and years that we need to have good health education in our schools, and that should be a priority. And now they're beginning to get some support. And I think when we see the communities band together for that kind of support, I think we'll see a revolution across this country that will be very significant.